Good morning. My name is Hilary Sirman. I'm the Education Director with the Center for Suicide Prevention. I'm joined this morning by my colleague Akash Asif, and we are honored to be able to have this opportunity to present on suicide awareness as part of the Breaking the Silence event. A quick rundown of our agenda this morning. We'll start with introductions again of who we are. We'll look at some of the myths and facts of suicide. So really placing the issue of suicide in context of what we understand on a societal level. Then we'll look a little bit more deeper at the issue. So who is affected by suicide, or who would consider suicide, and why might they? We'll look at some best practices, talk a little bit about the work that we do at the Center for Suicide Prevention, and we'll finish the presentation by really focusing on our new Men in Suicide campaign called Buddy Up. And we'll leave some information for you and how you can keep in touch and stay in contact with us after the presentation. So as I mentioned, my name is Hilary Sirman. I am the Education Director at the Center for Suicide Prevention. I've been with the Center for approximately 7 years now. Prior to coming to CSP, I worked in Australia in human resources for a mining company. And many of the issues that we're going to talk about later in the Buddy Up campaign were things that I experienced from a workplace health and safety perspective as an HR officer on site. So a male-dominated industry, issues of isolation, remote working, substance abuse, depression, all those sorts of things I saw in a work context as well. Akash, would you like to introduce yourself?
Yes, good morning, everyone. My name is Akash Asif. I'm the Partnerships and External Relations Director at the Center for Suicide Prevention. A little bit about me. Most of my life has been spent here in Calgary. So I went to the University of Calgary, worked a degree in psychology, business, and master's in public policy. I've been with the Center for Suicide Prevention for about 1 year now. But prior to this, my work experience was in the energy sector as well as the software sector. So yeah, we're super excited to be part of this this event, and looking forward to presenting this morning.
Thanks, Akash. One of the benefits that we have in the times of COVID is that we can gather online to have these kinds of important discussions, and in particular these times are maybe more important than ever. That's one of the benefits. One of the cons is that we are online. One of our tenets of our work at the Center for Suicide Prevention is our safety. So safety of ourselves and safety of our participants. So if there's something that comes up for you in the course of the presentation, either during or after, we just wanted to be sure to provide some information about where you can access support if you need. So support is available in Calgary through the Distress Center Calgary. So that's a 24-hour crisis line that you can contact by phone or text anytime if you feel that you need some support, as well as the general 211 number, which is an easily accessible number across the province as well. So we just we wanted to make sure that we provided that for you at the start of this conversation, because some of the things we can talk about can be difficult for some. Some of you may have a firsthand experience with suicide. Some of you may not, and this may be unsettling for you. So we just wanted to start with that information. I also wanted to pass along some information from the organizers that if you have questions or comments that come up, please feel free to use and put those in the box for us, and we'll try to get to those at the end as time allows. So let's get started with the first part of our presentation, which is this idea around myths and facts. So what do we understand, or what might we have heard or not understand about suicide? So we have a series of questions or statements that we'd like to put forward to you. So if you could respond perhaps in the chat if you think that this is a myth or a fact, if you feel comfortable typing that in. We'd like to start with our first statement. So this is that globally, more people die by suicide than in war and homicide combined. So if you think this is a myth, you could type that in. Or if you think it's a fact. Thanks. Oh, great. Everybody's throwing in. Excellent. Thank you all. Great responses. Great. Thank you all for that. Well, if you said fact, you were correct. So we know that globally around the world, over 800,000 people die annually due to suicide. And that's more than 500,000 combined in war and homicide combined. So the latest information we actually have from the World Health Organization puts this number closer to 1 million. So we know that around the world, more than 1 million lives each year are lost to suicide. So let's look at our next statement. So is this a myth or a fact? So more men die by suicide than women. And you can use the chat box for your responses, please. Thank you. Thank you all. Yeah, so if you said fact, you were correct. We know that in Canada that male suicide rates are historically higher than women's, and it's at a rate of approximately 3 to 1. We know that women, and on average, attempt more. So women will attempt up to 4 times more, but men will complete suicide at a rate that's approximately 3 to 1 compared to women. And we'll talk a little bit when Akash mentions the Buddy Up campaign about some of the reasons why this might be. So why are men in this more vulnerable group? What are some characteristics or common traits about men that we see that might explain why this is? If we think about age groups impacted most directly by suicide now, so teenagers die by suicide more than any other age group. Do we think this is a fact or a myth? Thanks for all your chat responses. This is great to see these coming in. This is actually a myth, and it's contrary to what we might believe when we see in the media or the news. We often think of women, or particularly perhaps teenage girls or things like that. We know that men, approximately ages 45 to 65, have the highest numbers of suicide. And again, Akash is going to delve a little bit more into this with the Buddy Up campaign material about why it might be that men, and particularly men in their middle age, in the middle years, might be most vulnerable. Our next statement. Asking someone about suicide may put the idea in their mind. Do we think this is a myth or a fact? And this is a common myth or fact that we often get asked when we go out to do presentations. Thanks for all the responses coming through on the chat. Great. This is a myth, and we can leave any sort of takeaway for you from our presentation this morning is this. So talking with someone who you feel might be at risk of suicide or that you might be concerned about actually reduces the likelihood that they will attempt. So asking directly about suicide is seen as a protective factor. So we often ask, why might that be? Wouldn't that cause someone to think about it if they're already struggling? Well, from what we know from the literature and clinical work in suicide prevention, it's actually a relief of burden. So if someone feels that they've been struggling or they can't reach out or they don't know how to reach out, if someone can offer that help or ask that question directly, sort of feels like, that the floodgate has been opened in a sense that, finally someone has acknowledged this, or maybe an opportunity for me to talk about the pain that I'm experiencing. So if anything, remember, asking someone and asking them directly will not put the idea in their mind. Now, I alluded to this a little bit when I was just saying, so our next statement. So people who think of suicide want to die. Do we think this is a myth or a fact? Great. Thanks for all the responses coming in. So the Center for Suicide Prevention, our understanding of this issue is that this is a myth. So people who think about suicide don't actually want to die. What it is that they want is the pain of living to end. And that's not the same thing as wanting to die in our mind. So again, it's that release from pain, release from struggle, release from the burden that they're feeling. So thank you for all of your input on the chat part. We'd like to take our understanding now of suicide, some of the common myths and understandings, what we might know or might not know, and then drill a little bit deeper now into who is impacted by suicide. So who dies by suicide? The work that we do at the center, we really try to start with a stigma reduction. And the understanding is that who's affected by suicide or who could die by suicide is all of us. So anyone can have thoughts and feelings of suicide. Suicide can be very inclusive. We're all included in this. However, there are some groups or populations that might be vulnerable or more risk. For example, Indigenous men, so primarily young men. We talked about middle-aged men as well, that 40 year to 65-year-olds. And then our LGBTQ plus, two-spirited plus youth as well. So again, when we look at stigma reduction, we understand all of us are vulnerable, all of us are impacted, but we do have some groups that might be more at risk or more vulnerable. So why do people die by suicide? Well, suicide is complex because people are complex. We're human beings. And we look at suicide, we often think, if we could just find out the why, the one reason. Well, we understand it's not just down to one cause or one issue. It's that interaction of potential risk factors, not necessarily the volume. The way that one person may handle a certain risk factor can be completely different from how someone else does. We know when people are considering suicide, it's often for a few reasons. So one, there's some sort of, we talked about that pain or that pain of living, deep psychological pain that they feel. The clinicians and researchers talk about a cognitive constriction then in this case. So in my space of pain, I sort of have those blinders on and I can't sort of see options or ways out. And I sort of get into that tunnel vision, that cognitive constriction, that this is the only path I have. And again, if we talk about this reluctance to reach out. So the work at the Center for Suicide Prevention, and particularly highlighted in the work of Buddy Up, is how can we be the help offering? So if someone is already struggling or they're in pain, they often might feel unable or feel this pressure, just reach out for help. Well, sometimes you're not just able to do that. So if we know that 1 in 5 of us is experiencing a mental health issue, crisis, or problem, there are also 4 out of 5 of us around an individual who can be those help offerers, understand the signs, know what to say, and how to connect that person to support. So we talk a little bit now about statistics. So we look at the population of Alberta, and these are numbers from 2018, just over 4 million. Reported suicides we had in the province in 2018 were 551. We know, however, as well, that unreported suicides can be anywhere from 5 to 25% greater. We also know suicide behaviors, so including self-harm, things like attempts, they can be 40 to 100 times greater than the number of reported suicides. We think about people with thoughts of suicide at any point in the province. It's 1 in 20 or 5% of the population. So in 2018 in our province, we could expect to see over 200,000 people at any point in the year with thoughts of suicide. So what are some of the tools that we might have, or what are some of the best practices that we can enact for suicide prevention? There are not many best practices, but the World Health Organization has identified 4 key ones. That includes open and easy access to mental health care, so particularly early screening, things like depression, anxiety, So identifying and dealing with these issues early enough so that they don't escalate later on to a crisis point. Also look at responsible media reporting. So how do we use, and Canadian journalists use something called the mindset guidelines. So how do they tend to report on suicide or mental health issues in the media? That's helpful, that doesn't sensationalize or glamorize. In Canada, we are also fortunate that we do have different restrictions of lethal means compared to a country, for example, the United States with our gun controls. But one of our greatest tools in mental health and suicide prevention is education. And that's where an organization like us comes into the picture. So the Center for Suicide Prevention. So our brand is that we educate for life. We've been equipping Canadians and Albertans and across the country to respond to people at risk of suicide since 1981. We are a branch of the Canadian Mental Health Association, and we're located in Calgary. We have a small team here in the office in Calgary, but we do have approximately 150 trainers on contract to us, sort of our network into the community, our community educators. And they go out into organizations, into workplaces, into community groups, into universities, and they provide training on suicide prevention. The model that we follow is really sort of quite simple, and it's something that we start with this idea of noticing. So awareness. So if we are worried about someone, we have those sort of red flags or that spidey senses. There's something is just not quite right. So we notice what's going on, or we try to notice what's going on. The next step is to really reach out to that person. From there, we start a conversation, and it can be simple. It doesn't have to be intense. Just noticing changes in behavior, noticing how the person's been behaving or not, and then asking directly about suicide. From noticing, reaching out to an individual, asking directly about suicide, then our role is not to solve the problem. It's not to be that counselor or clinician. There are professionals that we can support and connect that person to, and that's really our role. So what are the services then? So we've looked at a model of noticing, reaching out, asking directly, and supporting and connecting with someone for help. What are the services that CSP provides to help us along this journey? The first is that we provide information. So we are community educators. We take the latest research or knowledge or information out there, and we distill it down into bite-sized chunks that go across community. So we publish these in toolkits, articles, blogs, posters. We have the largest English language collection of suicide resources in the world. We have over 45,000 items available on our database from a variety of topics. So if there's anything in particular relating to any aspect of suicide, chances are we have it or we can locate it for you. We're also trainers, so we're community trainers. We have knowledge-based and skills-based workshops. So one is understanding and knowledge of suicide, and then the next is developing that intervention skills. So how do we actually ask the question about suicide? And then looking at populations. So for example, Indigenous populations. We have a stream of workshop related to Indigenous community. And we also have a series of online learning workshops as well. In our social media, we are active on all the usual platforms on Facebook, Twitter, Instagram, and LinkedIn. If we look at the outputs of our center, and our executive director just released this last night in our annual general meeting, this year we impacted over 400,000 people directly. We had over 7,000 workshop participants come to our programs, reference queries, website visits, our social media followers, and our mailing list subscribers. So a lot of people accessing a lot of information, which is tremendous. And then we think directly about the training that we provide. So there are over 500 opportunities for learning directly around skills related to suicide prevention. Over 80,000 workshop learning hours we provided in over 400 workshops. And we can see some of the data below as well about news stories, presentations we've done, and these ongoing news releases and new resources that we produce. When we think about workshops available as well, if you are interested in more detail, some of you may have already taken some of these or might want some more information. The two most common ones that we recommend in terms of knowledge base or awareness building is Safe Talk. And that's a half-day workshop called Suicide Alertness for Everyone. The next level, if we think about skills-based workshop, so really diving down into that conversation with someone that we might be concerned about, it's called ASSIST. And that's the Applied Suicide Intervention Skills Training Program. And that's more of your intensive suicide first aid of a 2-day training program. At this point, I'm going to turn it over now to Akash. So after we've looked at a little bit about the issue of suicide, who's impacted, why, what the work that we do in the community through education and awareness of suicide prevention. And one of those particular outputs is the latest campaign that we've just released on men and suicide called Buddy Up. So Akash, I'm going to stop sharing my screen and let you share yours.
Awesome. Thank you, Hilary, for that. So I'm just trying to share my screen here. So I think I got it here. Can you see my screen? Perfect. Welcome again, everybody. Yeah, that was really insightful there, Hilary. I'm going to be chatting more about our Buddy Up campaign. That's very new right now, so we're excited to kind of launch it and talk more about it. It's a campaign focused on suicide prevention for men. But before we kind of get going on this, I wanted to kind of share a little bit about why this is important to me specifically as well. And so, like I mentioned earlier in my introduction, from Calgary, and about 5 years ago, I remember being my first job in the energy industry and the company that I was working with was headquartered outside of Calgary. So the way that it worked was every week on, let's say, a Wednesday, I would have a meeting with my boss to kind of talk about next steps, talk about our weekly activities. And the way those meetings were structured were that we would have our conversation at 11 a.m., very similar to time right now, as well as then we'd kind of go off on our own for lunch and then reconvene at 1 p.m. for kind of a larger meeting. And that kind of continued on for about a year and a half. And then I still remember the day when we had our meeting. We had our conversation. It went well. I went for lunch, and then when I came back at 1 p.m., he wasn't there to chair that meeting. And during that time span, he had actually taken his life, is what we figured out. So that was a very impactful event in my life. Something that really took me back. I know for a while there, I was thinking to myself, what could I have done better, or what could I have done? Maybe I was the last person who spoke to this individual. And over the course of the next few months, I started then having conversations with a lot of my buddies who are all in all types of different fields, trying to climb the corporate ladder. Someone's trying to start their own new company. Someone's trying to become a doctor. And very quickly, I realized how many of these individuals have troubles and struggles with their mental health, and how many of them have thoughts of suicide. So for me, I've been really wanting to kind of help make an impact, help these guys, my friends. So when I joined the CSP, Center for Suicide Prevention, a year plus ago, this was a huge priority for me, a goal that I wanted to work on. And so super excited to launch this campaign called Buddy Up, that not only just allows me to help out my buddies, but allows anybody to help their buddies as well. So a little bit of why this is very important to me. Now we'll kind of go into the campaign itself a little bit. I know that Hilary has mentioned that men die by suicide 3 times more often than women. So why is that? I know she's mentioned that it's the middle-aged men, and to me, this was a surprise when I joined. Between 45 to 60, around that age range, die by suicide more often than anyone else. And some of the reasons for that are men are often socialized not to express emotion. So may weaken your manlyhood. If you're talking about your emotions, you might be out for hope for wings, and it's not what you talk about, you hide it. That's kind of how we're socialized to do. We're not supposed to talk about how we're feeling. The other pieces to it is men are subject to the expectation that they'll persevere through adverse situations. So a lot of the times we'll hear suck it up, or or I can get through this. It'll work out. You try to kind of tell yourself that, and sometimes you can. Maybe there's times where you can, but other times you do need some help, and you need to do more than just persevere and try to get through it. And then another reason why is that men are less likely to reach out for help compared to women as well. And I think the reason for that, frankly, I think is the other points I mentioned above. You're not supposed to show your emotion, and you're supposed to persevere, so you're not supposed to ask for help. So those are some of the reasons why men are at a higher risk there. So now I'm going to chat a little bit about kind of the Buddy Up campaign. So the design stage, what did we do to kind of come up with this campaign? So this campaign has been developed for men by men. So what does that mean when I say that? We've had probably over 50 men participate in this event, in this design phase, people who came together and talked about what's going on, what do they find are some of the barriers for men getting the help that they may need. So for this campaign, there's two outputs that we identified at the beginning. The first one was to create kind of a visual message, something that people could see, and right away they recognize, yeah, that's for suicide prevention for men, that's Center for Suicide Prevention. So it's kind of that Nike swoosh. When you see the swoosh, you know it's Nike. As well as a guide on how to help your buddies. So that's another thing that we wanted to work on. Buddy Up is all about help offering. Something that Hilary mentioned earlier is it's focused on guys recognizing warning signs, asking their buddies how they're doing, and less so on the individual seeking help. So guys said during our talks, they said, yeah, I'm willing to help my buddy, but I don't really know how to. So we created kind of a guide that I'll go through in a second here that kind of outlines what can guys do when they're trying to buddy up, or what can anyone do when they're trying to buddy up with their buddies. So for this design phase, we had an advisory group and as well as focus groups. So both of these work together to kind of both create the strategy as well as vet the strategy. So together, like I mentioned, over 50 individuals were involved, but we were able to accomplish and get something going. So what were some of so I mentioned having these people involved. What type of feedback did we receive? So first thing was that we were told that it's hard for men to talk about their emotions. So how do we get there? The first piece was we talked about how do we get some of the masculine terms that are out there and kind of almost turn them around into offering help and helping out your buddy. So the terms courageous and loyal really stood out to people. So it's all about helping someone, actually realizing that it's more about just talking about having small talks or talking about something else. So have the courage to offer help. So be courageous. And then the second piece, for example, is be loyal to your buddy by looking after them. Like actually helping someone who has struggles with their mental health or thoughts of suicide. That is true loyalty right there. The other piece was that the guy said the resources should act as a toolbox. So they should be visually driven, concise, and easy to navigate. So like I mentioned, when we went through kind of our focus groups and our advisory committee, we really wanted to make sure that it's short, concise, people can open it up on their phone, and within kind of 30 seconds to a minute, they get their information and they can move on or use that information in that sense. So don't want people to stick around for, I mean, everybody's welcome to, but that's, we wanted to make it as easily accessible as possible. And then the last kind of piece that we received was this really statement of how are you really doing? So this is kind of the campaign slogan, if you can call it, is how are you really doing? So a lot of the times we ask our buddies and they'll say, great, how are you? And I'll say great too. And then we move on to our small talk and get into deeper conversations moving forward. But it's really focusing on how someone is. And something to keep in mind when we're, and the outline behaviors and some of the warning signs that may exist, even though someone might just say, I'm doing fine. So something to realize and something during our conversations were not everyone with thoughts of suicide will look distressed. So that's something I'll show in a second here, but they don't need to look super sad, hands in their head, like head in their hands kind of deal. Just that could happen, but it's not always the case. And then also really focusing on active listening and creating a safe space. So yeah, you may notice something, but then actually stay there and be there with them and then talk to them and make sure that they feel comfortable talking to you. That was kind of some of the feedback. We received a ton of more feedback, but those are some of the ones that I wanted to highlight. So let's check it out. So if I can hopefully make technology work here, the website that you can go to as well as buddyup.ca. So when I go here, you'll see that this is buddyup.ca. So let me try to maximize my screen here. You'll come down to this web page right here, and you'll see it says Preventing Suicide in Men. And this top piece right here with all the different characters is that visual piece, that I was talking about with our output. So when you look at this, hopefully we're gonna get to the point where you see this as being something related to suicide prevention for men. So far we've released a few different characters. As you can see, we have Amir, Liam, Steve, Chris, Jim, representing different professions, ages, and additional demographics as well. The other thing I do want to point out here is if you look at Amir right there, he doesn't look very distressed. So we wanted to really point that out with my previous comment as well, is that not everyone with thoughts of suicide is going to have his tie undone, kind of sad face. He looks well put together, but there's other warning signs that might be there. So this is the website of Buddy Up. Here's a little table of content with a lot of information, but the one that I really want to go into is how to talk to someone you're worried about. This is the guide that we created. So I'm not gonna, well, I mean, I can go there, and the website has all of the steps kind of listed here in order, but there's an infographic that's created here as well that you can print out and post in different various spots. So I'm gonna take it right to the infographic. 4 steps. Something we got from our focus groups and our advisory committee was quick. We initially had 6 steps, for example. Cut it down, 4 steps is all I got, is what we were told. So men have a suicide rate 3 times higher than women. Here's what you can do. The first pieces are paying attention. So noticing changes. Someone drinking more than usual. Is someone apparently more tired or distant? Are they more irritable? Noticing those things those are some of the warning signs. Is something that you gotta be mindful of when you are talking to your buddies, when you are hanging out with them. Second of all is starting a conversation. So choose a comfortable setting. I'll say, the one that I'll point out here is driving the car. Something that was mentioned to us, for example, was that guys are more likely to have conversations where they might not have to lock eyes and not make eye contact. So have those conversations over the phone or while driving in a car. And if you're comfortable, do it over a hangout spot where you can have that one-to-one conversation and mention each other. So, and then mention what you noticed, right? So don't blame them or shame them, but just let them know that you don't think they've been themselves lately. How are they doing? And like I said earlier, active listening. Make them feel comfortable. Don't make it feel rushed. The 3rd and 4th steps are keeping it going. So this is something I'll bring up once again. Very important here from the advisory committee and focus groups that we had was a lot of guys said, I'm willing to help my buddies. I'm willing to ask them how they're doing. But then if they tell me I'm thinking about suicide, or if they're telling me that they're struggling with their mental health, what do I do next? And a lot of them said that right now they'll probably switch the conversation up because they don't know how to help. So this piece of keeping it going is incredibly important. Ask questions and listen to what they say. Don't make it seem like they're overreacting, and back them up. Tell them that sounds really hard what they're going through. And then ask them, if you are worried about them, are they thinking about suicide? And if they are, don't panic. Let them know, thank you for telling me. And it's really hard to do. It's not easy to tell someone you having thoughts of suicide, but tell them to thank them and then tell them you're there for them. And then the last piece is stick to your role. So if someone does tell you, keep in mind you're a friend, not their counselor. So ask them if they have other friends and people for support, and ensure that they contact these individuals. Call the Crisis Services Canada line together. Follow the conversation with them. But if they do have imminent plans to die, contact 911 and don't let them be alone. So very quick guide that someone can read, 4 steps to keep in mind. There's a nice little logo here. I've taken a picture as well if you need to. I mean, you can have this anywhere, but you can do that piece as well. So now I'm going to try and get back to my PowerPoint here. So that's the Buddy Up website there. You can visit on your own time. Love to know your feedback as well. So where are we now, right now with this campaign? So Buddy Up, the campaign was launched in early May. up to 2020, so this year. So what we've done so far, we had to make a little bit of a shift due to the current environment and the pandemic. We had a social media launch that you can see kind of on the left there. Those are some of our characters: Twitter, Instagram, LinkedIn, we got it all. And then on the right, we were very fortunate that Pattison Outdoor Advertising told us that they're willing to kind of put our campaign stuff on their billboards as well as our transit ads across Calgary. So for the last 2 months, we've had all of these signs all across kind of the city here. It is only Calgary right now. And we've had a lot of great feedback for that. So we've had a lot of corporations reach out, organizations reach out, and they want us to ask us, how do we get involved? So how do they get involved? Which is my next slide. So that's our second stage of implementation. So what we're trying to do now with our Buddy Up campaign here is we want to do a month-long campaign in September of this year. So what does that look like? We are asking for you to become champions by taking this campaign to your buddies. That could be, anyone can be a champion, by the way. Doesn't have to be men, it can be anyone. You can take that to your workplace, sports teams, social media, whatever you may feel like this message can reach out and get to more guys out there. And so what we're trying to do is, this is going to be a month-long campaign. We want our champions to find locations such as workplaces and social media, and then put up some of this print material as well as the virtual material as a commitment long for September kind of thing. So you can take posters with you, infographics, coasters, stickers, and car air fresheners. So that's always a unique one, the air fresheners. Once again, hoping to prompt a conversation. If you're, for example, in a car, like I said, a lot of guys said, I'm willing to have a conversation in a car, so why not put a Buddy Up air freshener in your car? And if someone joins you on a drive, they may ask you, what is that? And hopefully that might prompt a conversation with someone. So that's kind of the campaign that we're trying to do. We want to bring a lot of these print materials throughout your organizations, throughout your settings. There's going to be a chance to win a grand prize at the end, with hopefully that includes a workshop, pizza party, which is pretty cool, as well as a trophy, a Buddy Up trophy. So we'll have kind of a little bit of a contest going on during the month of September as well. So that's kind of where we're going here in the next few months. Right now we're looking for champions. And yeah, so I will conclude this portion of the presentation with just telling you to keep in touch. If you'd like to be a champion, or if you know of settings that might benefit from bringing in some of this material, feel free to reach out to me. My email is right there. And if you have any questions about our education and training, all the information that Hilary provided earlier on, her emails on this slide as well. And we look forward to hearing from you. Thank you very much. So I guess now, do we have any questions? We're open to take those.
Thanks for all your questions. I figured out how to get responses, I think, through to everyone. So thanks for the questions that have been coming in so far. Some really great feedback. We have a few moments left. I know this Zoom account gets taken away by another session right at noon, but we are happy to take some more questions or information. You're welcome, Maria.
Hilary, I guess I remember there's one here that said under education when you were mentioning best practices with the survey.
Yes. Yeah. Thanks, Akash. And I think that was Jag's question, and Heather's question. When we talk about surveillance, it's really evaluating those outcomes. So it's gathering data to inform policy or to inform program development. So what are the trends? What are the ages? What are the demographics? That's sort of the issue. So evaluating outcomes, trends, and demographics, the idea to inform policy and to inform project work in suicide prevention. So I hope that answers that question. Sorry, Heather, for the delay in getting that back to you.
I have a question. Are you able to hear me? Yeah. All right. So, just going back to the Safe Talk and the Assist, and the question I had, you did answer absolutely. It's offered in person. My question then follow-up is, as we move more towards online, you know, as a result of COVID and potentially fears people have of coming together for in-person type settings, classes, is there opportunity for Safe Talk and Assist to also be offered online, or is it just too many barriers and no benefits other than in person? Like I'm just wanting to know where does Safe Talk and Assist kind of fit into online learning?
Yeah, great question. Thank you. At this point, due to participant safety and this idea of asking the question directly, so we know it's one thing to watch a video or to get the knowledge or understand how to ask the question. It's quite another when you actually sit directly face to face with a person and practice that exchange. For those reasons, so for the skills practice and for safety of participants, at this time, Safe Talk and Assist remain in person. We are doing reduced capacity workshops out of our center right now with all the physical distancing and health protocols in place that we can. So we've reduced workshops to 12 people and we normally take about 30. Again, it depends on the center, it depends on the size, it depends on the physical distancing. We do offer our other programs. So there's a program called START. It's not that skills intervention, but it is an online 1-hour awareness session. We have the link to that. I put up the website for our workshop registration. So you can look for START, which is the online 1-hour program. Again, it's more the knowledge base and awareness. It's not that skill development, but it's a great program to look at. As well, we are moving online into our knowledge workshops with our child and youth, as well as some of our Indigenous workshops as well. So Zoom is always a challenge and how can you get information across, but then also how can you ensure that people are actually developing the skills safely? So that's been our real focus for us. But START is online, Straight Talk is online, our program called Platter Teddies, Moving Little Cub online, as well as our River of Life, which is our Indigenous program.
Perfect, thank you.
Thanks so much. Are there any, oh, you're welcome, Robin. Any other comments or questions? Oh, I see some questions in the Q&A. A complaint about someone as a volunteer, by someone as a volunteer in a crisis line. Sorry to hear that. I would contact that crisis line directly, I think. We don't operate, we operate so independently of crisis lines, but I would think if you had an experience like that, I would go directly back to that crisis line and ask to speak to a clinical manager or program manager. I'm not sure if that helps, but I hope that you can get your feedback across. We do have a question now about debriefing work after assist training. For those who take the course a week after, it was quite a triggering training. Sure, it'd be good to have a check-in afterwards. Great question, and that speaks to the safety of the training as well. Assist is always delivered by 2 trainers, so we have that built-in sort of protection and safety. Afterwards, we do some follow-up surveying afterwards with this idea of triggering support. We often have participants who will reach back out to the trainers who delivered their course, and the trainers' contact information is generally made available at the start of that training. So if there are questions or issues or perhaps some ongoing support afterwards, the trainers of the program are available for participants, as well as 211, depending on what region you live in, or as well as your regional distress line as well. So please, if you feel that need, particularly after taking assist training, it is intensive 2 days. I really encourage you to seek out those support as well. But thanks for the question. And I think that speaks even further to why we do assist in person. Okay, I see another question from Robin around first responders. Yes, absolutely. Robin, if you look at the resources section of our website, and I'll just actually type in our website for you. If you go to suicideinfo.ca and check on, you can either look at resources or workshops. The resources you can type in, we have toolkits, we have blogs all around military particularly, but then also around first responders. We think of police, paramedics, 911, all those types of individuals on the front line as well. We do have information specifically for for first responders. So thanks for that question.
Aaron, I think you have a question. Aaron?
Yeah, it's actually Mark Corthius. I had to sign in through my wife's account. Hi, Akash and Hilary, and thanks for participating in great presentation.
Thank you.
I have a question for you with respect to, you had a slide around media and how they talk about suicide. I'm wondering, curious as to your thoughts about media in a more broader context today, and how you know, the landscape is shifting. Podcasts, YouTube, and other forms of social media and online media is really crowding out the traditional media marketplace, and therefore fewer staff, fewer fact checkers. Clickbait is becoming increasingly prominent, and I think the extremes dominate the media when it's really probably a small subset of the population. I think that has negative consequences societally for mental health, and as a byproduct, potentially suicide. And I'm wondering if you guys have given any thought to that as an organization more broadly around looking at media and suicide prevention.
Great question. And it's Mark, is it? Not Aaron?
Correct.
Yeah. Thanks, Mark. We've been involved with the Mental Health Commission of Canada on really reaching out to the industry of journalists in Canada. And we do it through something in partnership with journalists from the CBC, who put together a journalism forum. And when I talk really briefly about the mindset guidelines, if you know the reporter Andre Picard with the Globe and Mail, he does exceptional work around mental health. And not only in his own reporting and trying to keep that standard of journalism, but also in informing and educating this next generation of journalists in Canada. And, you know, these are the journalists who, you know, sort of all those issues that you talked about in terms of the new reality of reporting. We go into the journalism programs of NAIT, Lethbridge College. I'll be speaking to them in October. And we talk about the mindset guidelines. So this wasn't developed by us. It was developed by this forum of journalists, initiated through Andre Picard, to develop their own standards for their own profession on how can we respond and report responsibly in mediums and forums and language that is respectful and responsible. And we're happy to serve as the educators on that front. So looking at what is best practice, and then how do we get into current journalists field and streams, but then also how do we help educate and inform the next generation of journalists. And I can tell you that the response that we get is extremely positive. There are journalists who want to do good work, and they want to have a responsible and respectful message out there. And we're so heartened to see at the end of every article a list of support resources where, you know, we used to not have that. It used to just sort of be, you know, the story and the drama or the sensationalism, which isn't helpful. But now we're really starting to see, you know, there's always room for improvement, but we're really starting to see that engagement in terms of providing the tools and resources at the end of articles and publishing. So I think the best resource that we can provide is to be educators and to help inform current journalism, but as well as the future.
That's fantastic, that answer.
Thank you. But to Sharon, just to answer your question without getting into a political statement, we do not receive government funding at the Center for Suicide Prevention. We levy user fees primarily through our workshops to provide the funds for our work. So that includes our information services that we endeavor to provide free into community, as well as the training network that we support across Canada. We've got about 4 minutes left before the next presentation starts on this Zoom account. Do we have any other questions or comments? You're welcome. Thank you.
Thank you.
So Akash has provided the, Akash, if you have a chance just to put up our email addresses again,
Yes.
please reach out. There's a lot more information clearly in this issue, and I'm sure you other sessions as well, that the spectrum of mental health is significant. And if there's any further questions or comments or anything you would like to know, specifically related to suicide prevention, information questions, training questions, please don't hesitate to reach out and let us know. And thank you again to Amber and to the team Breaking the Silence for inviting us to participate today. It was an honor.